So how do we treat keratoconus? Well, thankfully the management has revolutionised over the last 20 years. 20 years ago, the management was optical, just providing people with spectacles, contact lenses, rigid gas permeable contact lenses to restore the vision, but nothing to alter the natural history. So the keratoconus would likely progress, and some of those patients would end up requiring a corneal transplant in order to restore a normal corneal shape and restore normal vision. And we could do that. All the research, all the work at that time was geared towards achieving better outcomes from corneal transplants. Thankfully, all this changed 10 years ago with the advent of corneal cross-linking. And this is a treatment to strengthen and stabilise the cornea. So this is exciting. We now have an intervention that we can use early on in the condition, providing it's picked up, in order to strengthen that cornea and stop it going on that journey to possibly needing a corneal transplant. So we're now able to hold patients at a level where spectacles can provide them with good vision. Over the last 5 to 10 years, with the advent of femtosecond laser technology to create very precise incisions within the cornea, we've been able to combine that technology with the placement of little rings of plastic within the cornea. They're made of PMMA, perspex. And we have different shapes and sizes that we can tailor and adjust to individual corneas. And we can use them to reshape the corneas in patients with mild to moderate keratoconus. So these are patients who may find that their vision can be corrected with a spectacle prescription, but it's really quite a high spectacle prescription. They may, for example, require 4 diopters of a corneal astigmatism, which is quite a lot. They may be like a general practitioner who came to see me, who's now become a friend, who had normal vision in one eye and an eye with only 2 diopters of corneal astigmatism, but relatively poor quality of vision. So his optometrist could get him to see almost all the way down the chart with that spectacle correction in one eye, but the quality of vision wasn't good. There was a slight ghosting to it even when the spectacle correction was in place. After we placed a corneal ring, its brand name is a Kera ring, after we placed a corneal ring in his cornea, we made the cornea more regular such that not only had we got rid of the prescription, but the quality of vision was there, and he felt his vision was balanced and matched in each eye. So what we're able to do now at St James Hospital in Leeds and at Custom Vision Clinic is look at our keratoconus patients and tailor the treatment to them. First of all, we're interested in whether there are signs of them progressing, and if they're progressing, then the priority is to stop that, and we use corneal cross-linking to achieve that. But for those patients with mild to moderate, and even some advanced cases, we want to see if we can reshape their cornea and improve the shape of the cornea and the quality of the vision. And it's such a simple, elegant procedure to use the laser to make a tunnel and place one of these rings to achieve that for patients. There is still a role for corneal transplantation, and one of my ambitions over this next decade is to ensure that we've established some kind of a screening program such that we can identify patients early enough that we can stop all of them from going on to needing a corneal transplant. So I ideally love to make corneal transplantation for keratoconus an operation that becomes extinct, an historical artefact that young surgeons just read about in the textbooks.